Nearly 34% of Black students report feeling so depressed in the past year that it was difficult to function on a daily basis. Hi, my name is Princess Jacob-Fambro. I'm a psychology major and Black student who has firsthand knowledge on the stresses of dealing with racism, oppression, and extreme poverty, while simultaneously being expected to prevail independently in a system built for my failure. And today, I will be talking about the lack of diversity when it comes to mental wellness options, healthcare professionals, and funding options for Black people. Audre Lorde once said, "The master's tools will never dismantle the master's house." And because of that fact, I say it's time we get some new tools. Tools that we have created, not tools that have been given to us by the same ideologies that also gave us the trauma. Here's the issue. Psychology, and the main type of therapy currently being funded, is built on a decades-old idea that getting diagnosed quickly and talking to someone about your problems over the span of 6 to 8 weeks is the magical cure for addressing your mental health. And I hate to spoil the ending, but it's not. Let's face it, like most of the systems that America currently runs on, Black people wasn't even a thought when the solutions were being created. Now that we know the problem, let's talk about the power that you have to help create tools that can really make a difference. First, take a minute to imagine that you are a young Black person battling depression all by yourself, because the only treatment that your parents' insurance covers just doesn't work. Because instead of being treated like a person seeking help, you're treated like a problem that needs to be fixed. Now imagine that you hear that there are Black-led, Black-serving, community-based organizations in your area that understand that there is no one path to mental wellness. They offer paint parties for days when words are hard to come by, but your emotions still need a way out. Music studios for days when the words flow, and an abundance of outdoor space for moments when the universe needs to speak to you. Some pay your college tuition and provide monthly stipends of $1,000 because they understand that mental wellness is about tackling all of the things adding stress to your life. And some have Afrocentric centered practices that help to build models that work for you. The good news is that you don't have to stop imagining, because places that offer these culturally relevant practices exist. Places such as 3rd Street Youth Center and Clinic and Westside Community Services located in San Francisco, California, and Youth Uprising located in Oakland, California. Sadly, some of these organizations rely almost entirely on government funding, and the government doesn't deem these practices as reimbursable. But that's where you come in. With more funding, specifically general operating support or unrestricted funding, this level of wellness equality doesn't have to stay in the confines of our imagination or be limited to the few organizations that can manage to stay afloat. With more funding, this level of care can be everywhere. It's time to put your money where your heart is. Why? Because change can't wait.